with an axillary lymph node dissection. So we've had lymph nodes removed here. However, everything on the left side is unaffected, not involved. So when we start with our training, and various training programs are a little different, but for the most part, people start with, especially in the Vater school, with the neck area, opening that proximal pathway and clearing the neck. Plus you have a number of lymph nodes in the neck. It's a very light massage. It's more stretching of the skin. You kind of have a two-way stretch and always have a release phase. Down at terminus. Not do all of the repetitions, just to show you. Not only do you have lymph nodes here on the side, you also have them in the back. Normally, if you're working on the side that's affected, you're trying to give it as many options for the fluid to flow. So you have functioning lymph nodes in the axillary area on the contralateral side, and you have functioning lymph nodes, as long as there's been no other cancer involvement, on the inguinal nodes. We're trying to route fluid not to this underarm where nodes have been removed or radiation has occurred, but to give it other alternatives where the fluid can be filtered and processed by functioning non-involved lymph nodes. Once you cross the midline of the chest, that skin will automatically drain to those lymph nodes. So there's a couple of techniques, things you would do. The first thing you would want to do, I'm going to have you pull your arm out, is just to kind of prep these lymph nodes. I always explain this to people because they always wonder why I'm working on the wrong side. Okay, so there's a couple of ways you can actually work fluid and train, to kind of cross over this, what we call like a watershed or a midline there. You can use windshield wipers, which truly as you're kind of walking across the upper chest. Or you can do kind of a rotary. In her case, just one hand's needed because that's all the space there is. kind of like what we said before, you can come down here and prepare the inguinal lymph nodes, which I won't do at this time. And then you can also work the rotaries going from, you can have them raise their arm and kind of work the rotaries going down, which I know is hard for you to see, but working from the underarm down to the inguinal nodes. If someone's rather large, you can use 2 hands. In this case, I'm just going to use one because it takes up her entire side. Once you've kind of, cleared those, open those, there's other things you can do, which I won't do for purpose sakes, but you can work along the intercostal areas on the opposite side to also kind of open up. You also have lymph nodes, which again, just for privacy's sake, you can do what we call soldiers. They're kind of, I'll use to show you, they're little, like we'll pretend, you push down and in, and you would work this along her sternum here, because you have lymph nodes that line the sternum. So you're kind of going in and up towards the head, and you can actually tend to work both sides of those around the sternum. You can also use that same soldiers to use if someone has had a mastectomy and they have a lot of swelling in the chest wall. You can actually get in those intercostal spaces and do the same soldiers, kind of working along those intercostal spaces to get out the swelling. Now, moving on to the arm, I tend to cheat instead of positioning it on my body to hold. I cheat and use a footstool. I just find it easier so that the patient does not have to hold their arm out, and then I can kind of relax. A lot of times when they'll teach you, they may teach you to rest it on your hip. Sometimes if they're really large and heavy, that's kind of a hard position to hold. So I just find it easier to take your stool and let it relax on my leg, and then it gives you 2 hands. If a person is really large, has a really edematous arm, you could use 2 hands and do the wipers. You kind of draw that line down. Remember, we're not wanting anything to go there, so we're going to work it around to the back and bring it back up this direction. So if they were really large, you could do a little bit of windshield wipers around. Usually the way they'll teach us, though, is to use the thumb circles, which I'll show you in just a minute. So thumb circles. You always want to start at the top of the arm, because if you have lymphedema, it's kind of like having a clogged drain. If you don't clear the clog out from the top, nothing from the bottom will move up and out. Once you've done a couple of lines this way, then you want to use what we call the pump and bring it up over that shoulder and then into the terminus. Once you complete an area, you just kind of move down and repeat that same process. And then again, each each time after you've repeated several lines, then you're bringing everything back up and out of the arm. And you would continue working down until you get kind of to the elbow crease. And you actually have lymph nodes in your elbow crease. And again, bringing that back up. Sometimes I'll raise and change and work from the back side of the elbow there, doing pumps up the back part of the arm. Again, nothing is being facilitated toward the axilla. It's all brought up to the back of the arm here at the deltoid, because the deltoid actually drains the terminus.
My refresher course.
When you get to the lower arm, especially if it was edematous, but in this case not really, you could do what we call an edema technique, where it's sort of like a double pump, where you can actually give more pressure into the arm as we're working it down. And you're getting a really good stretch on the skin. Again, when you bring it down to there, if you want to just clear that on out, and then you can pump it on up the arm again. If in the lower arm, sometimes people might develop what we call fibrotic tissue. If she had had a lot of swelling in the arm, we often sometimes see it develop along the ulnar border of the proximal forearm. So there's a couple things you can do when you have fibrotic tissue or hardening of the tissue from fluid and protein sitting there. You can actually do a lot of stationary circles in that area, and really give it some pressure. If you don't break up fibrotic tissue, fluid can't travel through it because it acts like a scar. So you have to get in there and work it. And if you didn't want to use stationary circles, you could actually get in there and use your little soldiers and really break it up. Sometimes you may actually want to do this first before you do the actual edema technique or the massage on the arm. If they had fibrotic tissue there, they may not have it, and you could have continued. Sometimes people develop a lot of pocketing or fluid on top of the hands that can get hard and fibrotic. So any of those same techniques up there could be performed down here before you did the massage. You could get in there and do a lot of stationary circles, or you could get in there and use soldiers to really try to break up any of that hard fibrotic tissue. Get in there between the joints. And once you've broken up any fibrotic tissue, then you can continue with doing thumb circles to work over the wrist and the hand. can see she has very good skin elasticity. No fibrotic tissue. No swelling. And kind of work those stationary circles over the wrist, you know, progressing back to working on the hand. And you can kind of repeat, you know, the same lines as you're traveling. Move to the middle. When you're doing the fingers, same things, you know, you can work stationary circles, thumb circles, I mean, on the fingers. You can actually do 2 fingers at one time. And you can even come in if they're swelling and work in the palm. Alternate thumb circles or do parallel. When you're finished, you want to bring everything back up to the top. Don't just stop at the bottom and leave all the fluid there. You want to make sure you bring it back up. Often when you're working on the side, we'll ask them to roll over onto their unaffected side. So I'm going to switch. I'm going to have you go closer over there, and I'll switch spots with you. And then you can have them kind of roll towards you, and then now you can work to that opposite side on the back. Sometimes they'll have subaxillary swelling that you'll see along in this area, and this is a good way of getting it using rotaries. As I mentioned earlier, you actually have lymph nodes along your spinal cord. And just like we work the back of the neck, you can come in here and use some deep pressure, kind of pushing in and up all along the spinal cord. And if they did have a lot of swelling in here, again, you could use the soldiers to work along the intercostal spaces in this area. And then again, when finishing out, we kind of work up the arm, bringing everything